Hi, I'm Dr. Pankaj Gupta, Study Chair for an innovative study in advanced lung cancer. This study will examine the effect of a drug called Naloxegol versus matching placebo in advanced lung adenocarcinoma. We know that when we give opioid medications such as morphine, pain is relieved, and this is because morphine and these medications act on opioid receptors in the brain. However, these same drugs also cause bad side effects such as constipation because opioid receptors are also expressed on peripheral tissues outside the brain. And more recently, there is increasing evidence from laboratory studies as well as studies in animals and some retrospective studies in people that opioid receptors expressed in tumor cells as well as in the blood vessels that feed tumors may be responsible for stimulating cancer growth. So, this study will examine the idea that blocking just these peripheral opioid receptors with a drug called naloxegol might relieve opioid induced side effects such as constipation and possibly also have a beneficial effect on cancer growth, thereby improving both quality of life and survival. And because this drug does not cross into the brain, it will not interfere with pain relief for which we give morphine and other opioids. Naloxegol is marketed under the trade name of Movantik by AstraZeneca. It is a selective opioid receptor antagonist that blocks only opioid receptors outside the brain and therefore does not interfere with the pain relief for which we give opioids. Both the drug and matching placebo will be provided for the study. It is an FDA approved medication for long term treatment of opioid induced constipation and is taken by mouth once a day. It does not carry a risk for dependency or abuse and is generally well tolerated. Patients with advanced lung adenocarcinoma will be eligible if they are not going to receive targeted therapy for their disease and will be treated with standard platinum pemetrexed based chemotherapy. The platinum based pemetrexed based chemotherapy can be started up to 14 days prior to registration or for up to 14 days after registration, and therefore there is a 28-day window of eligibility with respect to the chemotherapy. Checkpoint inhibitors such as pembrolizumab or anti-angiogenic drugs such as bevacizumab are allowed to be added to the platinum pemetrexed backbone. Importantly, patients with treated brain metastases will be eligible for study. This slide shows examples of eligible chemotherapy regimens, which include most of the regimens we commonly use, including either carboplatin or cisplatin with pemetrexed, this backbone with the addition of pembrolizumab or bevacizumab, and then maintenance therapy is also allowed with either of these single agents or combinations as shown. There are certain opioid medications and opioid-like medications that are prohibited either prior to enrollment as well as during the study, and those are shown here as well as listed in the study protocol. The reason for this is that these medications interfere with the opioid receptor to a smaller or greater extent, and if these patients are receiving such medications, then it will confound evaluating the effect of naloxegol. However, most of the opioid medications that we commonly use for pain relief are allowed. Patients will submit baseline data and a baseline blood sample at registration. Existing biopsy slides will be requested for correlative studies. Patients will be randomized to two FDA-approved doses, either 12.5 or 25 milligrams per day of the study drug versus matching placebo. Data will be collected every 3 weeks for up to 1 year, and this can be collected either at a clinic visit or in patients who are not able to come to the clinic, it can be collected by mail. Blood samples will be requested once in 3 and 6 weeks from the start of the study treatment. The sample size is 204 patients. The study duration will be 2 years, and we hope that with your help, we will be able to complete accrual within 2 years. Several aspects will be at the discretion of the treating oncologist, including the choice of chemotherapy regimen, dose adjustments, number of cycles, use of bevacizumab or pembrolizumab, use of maintenance therapy, supportive medications, and very importantly, we encourage providers to prescribe opioid and non-opioid analgesics as required to achieve adequate pain relief. Palliative radiation or treatment of brain metastasis is also allowed. We encourage patients to stay on the study even after progression because there are biologic and clinical reasons why naloxegol may continue to be of benefit in such patients. Importantly, our study does not prohibit patients from participating concurrently in another study. However, if patients want to enroll in a second or subsequent line trial that does not allow participation in our study, then they can discontinue our study treatment. Correlative studies will be performed on the existing tumor biopsy material as well as on blood samples at baseline, 3 and 6 weeks. Participation is strongly encouraged but not required. We encourage all of you to request patients to agree to participate in the study, in the correlative study, because we think that it might help to address some very important biologic and mechanistic questions about the effect of blocking peripheral opioid receptors in the setting of cancer. According to the CTSU's National Coverage Analysis, standard therapy, including the history and physical, blood tests, and platinum-based chemotherapy, should be billable to Medicare or third-party payers because that's all conventional care. The study drug and matching placebo will be provided by the study. If you have any questions or need more information, please reach out to either myself or our protocol coordinator Nivedita, whose contact information is shown here. Additional protocol contacts are listed in the study protocol, and the study slides are available on the CTSU website. Thank you for watching this video, and thank you for your interest in this study.